Welcome to radiologyinfo.org. In this short video, I'd like to help explain to you how to read your prostate MRI report. I served on the Committee for Prostate Imaging, Reporting and Data Systems, or PI-RADS, that helps standardize the way we do prostate MRI and how we interpret and report the results of the scans. Your radiologist wrote this report for your provider using medical terms and descriptions used by the PI-RADS document, and that can make it hard to understand. Some medical terms, such as heterogeneous, may look scary, but may not be serious. Your doctor can explain any findings mentioned in your report. Many of these findings are commonly seen in many patients and will cause you no harm. Write down any questions you may have and talk to your doctor or ask if you can speak to the radiologist. Your radiology report is divided into different sections: clinical history, technique, comparison, findings, and impression. Each section contains different information. The findings section lists what the radiologist saw on your exam. Findings may be normal, abnormal, but not likely to cause problems, or abnormal and may impact your health. Again, some abnormal findings may not significantly impact your health. Sometimes an exam covers an area of the body, but the report does not list any findings. This usually means the radiologist did not find any problems in that area. The impressions section summarizes the findings that the radiologist wants to make sure your doctor or healthcare provider is aware of. It lists the radiologist's conclusions and may have recommendations for additional testing. The PI-RADS document recommends that the radiologist give a 1 to 5 scale on how likely it is that you have a prostate cancer that is likely to harm you. The scale ranges from a very low risk of prostate cancer for a score of 1 to a very high likelihood for a score of 5. The overall risk of cancer depends on a number of things, in addition to what is seen on the scan. These include age, family history and genetics, the PSA level, and potentially other blood and urine tests, the size of the prostate, and whether they found cancer if you had a biopsy before. To arrive at the PI-RADS score, your radiologist will evaluate 3 or 4 different kinds of images: T2 weighted, which give the best definition of the anatomy of the prostate and suspicious areas; diffusion weighted imaging, or DWI, which is a measure of cellular packing and abnormal growth; and in some cases, dynamic contrast enhanced imaging, or DCE, which shows blood flow that can be increased in cancer. An apparent diffusion coefficient map, or ADC, is also calculated from the DWI. Your radiologist will also have T2 weighted images from different directions, including axial, which is like looking at the prostate from the top, and sagittal and coronal, which is like looking at the prostate from the side and front. These images often show other structures, such as bones, indicated by yellow arrows, and rectum, indicated by the purple arrow on axial images, and seminal vesicles, the glands that help make semen, in the blue circle. The seminal vesicles attached to the prostate, which is indicated by the brown circle. Also visible is the urethra, indicated by the green arrow, and the bladder, indicated by the yellow arrow. The radiologist will also list the zone, either the peripheral zone on the edges, indicated by the blue shading, or the transition zone, more centrally, indicated by the green shading. The radiologist will identify certain features of possible tumors, including size and shape. Possible tumors are often called lesions until we have proof of cancer. In these examples, the blue arrow shows how a tumor, which is very suspicious, PI-RADS 5, was proven on biopsy to be a significant cancer. A less abnormal lesion, PI-RADS 3, was a non-aggressive cancer, indicated by the green arrow. One feature that is concerning about the significant cancer is that it bulges out the edge of the prostate, shown by the orange arrow, which can be an early sign that the cancer may have spread just outside of the prostate. This is important in determining the stage of the cancer and to help guide treatment that will be required. Remember, Your radiology report is written for your healthcare provider, and that can make it hard to understand. Write down any questions and concerns you may have, and talk to your healthcare provider about any next steps. For more information about prostate MRI, visit radiologyinfo.org.